Dr. Shervin here from Artistic Dental Studio, and I'm sitting here with a nice and brief PowerPoint presentation about the topic of today, which is implant treatment. And I'm very excited because I've just tried my best to put together all the details and try to be as concise as possible at the same time. So let's dive in. Let's begin with a recap from the previous videos. If you watched the videos on tooth loss, we talked about different consequences and told you about how the teeth could move, the neighboring teeth could move toward the empty space, and also the opposing one could erupt into this empty space, and what it could cause in terms of, gum disease and also the dental decay and all the stuff. And let's move on with the next drawback of tooth loss, which would be bone loss actually. When we lose the teeth, then there is no stimulus by the teeth over jawbone. And this is what causes the jawbone to shrink over time. You can see different stages here. And the reason why I told you we need to take action as quickly as possible is because of this. So after a while, if we don't do anything, in majority of cases, we come up with insufficient bone, and then it makes the process or the treatment a bit more complicated. So we can easily avoid this by doing the treatment as quickly as possible. Now let's dive in and go to implant treatment itself. Let me introduce you to different parts of an implant. So as I told you, implant is just like a artificial root in the form of a screw. It is put inside the jawbone, and a strong connection actually is created between this screw and the jawbone over time. And then a crown is put over this screw. It's just like a normal natural tooth, but it is artificial, obviously. And as you can see here, there is a part in between which is called abutment, which acts as a connection between the crown and the implant. And connection is and the abutment is screwed over the implant, and the crown is either screwed or glued on the top of the abutment. Now, regarding the systems, there are many different implant systems on market. I don't say which one is better. I can't say which one is better or which one is worse. But what we can say is that the systems that have a better scientific backup, the ones that are more supported by literature, are the ones that we normally rely on more, and these are the ones that are normally more expensive. So they add to the cost of treatment, but it is definitely worth it. Now let me show you this process. So as you can see on the left, there is the jawbone after the tooth extraction. And as I said, if we procrastinate and do not do the treatment, after a while, the jawbone will become much thinner. Then we need to add the thickness by putting some bone graft material on the top of it, and it necessitates an extra surgical procedure, and also more time. So we need to increase the time, we need to increase the cost, we need to increase the discomfort. And then after a while, when everything actually heals, then we can go with the normal implant treatment and just popping the screw inside and do it as planned. Now regarding the modes, I wanted to tell you about, because it's very important. Some people are really afraid of the side effects, or I would say consequences of implant treatment. They may think that, well, it causes bleeding, it causes swelling, it causes bruising, it's painful, and these are all true. I don't want to say these things don't happen, but depending on the method used, these complications could be minimal. How? I will tell you. First of all, this is the normal implant treatment sequence. So what we basically need to do is to remove the tooth and then open the gum and put the implant inside the jawbone. After that, we close the gum, wait for a few months, and then open the gum again, put the abutment, and take the impression and make a crown on the top. This is the normal treatment sequence. Because we have to open the gum, it increases the amount of swelling, bruising, pain, and all the stuff. It's not something unbearable at all. It is just like normal tooth extraction. It's not something like extraordinary. But with the new systems on market, they're not that new, to be very honest. They've been on market for around, I would say, possibly 20 years. And these systems are called navigation systems. So by using these systems, we do all the planning before touching the patient. You know, we just take a scan, take some impressions. We don't do any surgical anything. And after planning all the things virtually on the computer, something is made like a stent, and it helps us do the implant treatment without a gum flap. In many cases, we can easily just create a hole through the gum and into the bone and put the implant inside. So it reduces those, I would say, pitfalls of implant treatment to a great extent. So it helps us a lot. This kind of treatment could be applicable in many cases. Some cases are not suitable for doing this kind of procedure, but it helps us a lot, and also the patients. And something else regarding timing. Some people like to have their tooth removed, have their implant same time, and have their crown on the top the same day. It's possible today, all right? It's not something that we can do for all patients, but it could be this quick, doing all the things in one day. And another type of, there's a spectrum. One side is immediate implant, immediate load. Another side is taking the tooth out, wait for the area to heal for 2 months something, and then put the implant inside, wait for another 3-4 months, and then put the crown on the top. So there's a range of treatments in terms of timing in between, and what actually determines which way we can go largely is determined by the scan and all the diagnostic procedures done by your dentist. I hope this short video could have given you some insight about implant treatment. Please put your comments and questions down below. I'm more than happy to answer all of them. And please share this video and like us on Facebook and IGTV. Thank you very much, and I'll see you next week with another episode about dental bridges. Thank you and enjoy your day. Bye.